Hello, everyone. Thank you for joining me today for a mental health presentation for anyone struggling. This is a presentation on just mental disorders that I have. And also, please note, I am subclinical and recovered, as in I have little to no symptoms, and I've been in therapy since I was 4 years old. And my mom is a psychotherapist, so I grew up with all that, and I still continue to work with those having issues with trauma and OCD, and then of course like other illnesses that come with all of that. But my main things that I volunteer with would be trauma and OCD. But I'm not licensed at all. I just know a lot of things because of all the things that I have. And this used to be, or no, it still is, a live stream from quite some time ago. And then it's also a video that I uploaded a couple days after the live stream because people were having trouble finding the live stream, especially older folk. But I did not have the lovely presentation on the screen because I had no idea how to do screen sharing. But of course, I know now because we're here. And I wanted to do a third and final version because I think that for people that need to read and to visualize, the other two videos are a bit difficult. But we are here today to talk about mental health and how to overcome your mental disorders. And yes, once again, important reminder. And yeah, I'm not a licensed professional, and I've never claimed to be. And I can't diagnose myself, including, well, and I can't diagnose anyone. Um, but the topics that we're going to talk about today, I've been professionally diagnosed with over the years, and that's where I'm coming from in a way to help. I don't know much about others, though I know like the basics, but that's why I'm just talking about the ones that we have in this presentation today. And so also, I'm going to throw a lot of information out there. All citations and resources that I mentioned will be in the description box below. So here's our agenda. What stuff do I have? I have OCD, PTSD, generalized anxiety disorder, depression, and ADHD. And you can tack on to that also social anxiety. And I used to have selective mutism. I don't really have that anymore. It's usually for kids and for some teenagers. I kind of got over that, but I still also have multiple speech impediments, which you might hear throughout this presentation because it's going to be a long one. So I apologize in advance. But yes, that's all of the stuff that I have. And I had this set up for a live stream, so that's why it says questions at the end. This is not a live stream, of course. So if you do have questions, though, please feel free to comment those, and I'll get to them as best as I can. Okay, so what is OCD and treatment options? So it's pretty rare. OCD is called obsessive compulsive disorder. It's a mental disorder characterized by intrusive thoughts, images, and feelings that cause distress. To try and get rid of these unwanted thoughts, images, and feelings, a person with OCD will perform repetitive behaviors or mental acts called compulsions. But no matter what, these compulsions do not help you and will only make OCD worse. Now, obsessions are intrusive, unwanted, and persistent thoughts, urges, or images that cause significant anxiety or distress. Common obsessions include fear of germs, fear of setting the house on fire, fear or losing a beloved item, randomly losing control and harming yourself or others, so on and so forth. It really can be anything. It will latch onto anything and anyone. Compulsions are repetitive behaviors or mental acts that a person feels driven to perform in response to an obsession or according to rules that must be followed rigidly. Common compulsions include tapping an item X number of times, checking an item to see if it's turned on or off, praying all day because you thought you said a bad word, so on and so forth. The obsession comes first, then the compulsion. This is called the OCD cycle. Now, compulsion examples, because a lot of people might not know or even be aware of. So there are physical compulsions and what you would call mental compulsions. But no matter the wording, compulsions are compulsions. Examples are washing your hands constantly so you don't get others sick, checking the stove 50 times so you don't burn down the house, asking 20 different people if you are a good person or not, constantly asking AI, can I wake up one day and be a serial killer? And then also constantly asking your spouse if they love you or not. The OCD cycle is as follows: intrusive thought, feeling, or image, anxiety, compulsive behavior, temporary relief, and then the cycle continues. Why is that blurry? Let's see. Let's go back. Oh no, internet. Can you write yourself? I guess not. Oh, it's getting better. See, I'm being nice to it. So then it got better. Okay. So how do you break the OCD cycle? You do not do the compulsion. So an example of the OCD cycle, you have to wash your hands 50 times or else you will make your loved ones sick and kill them. So then that's the anxiety. And then you feel like, and then you do wash your hands 50 times in the row. And then that's your temporary relief until the intrusive thought comes back and asks for more. It always asks for more. So, example of breaking the OCD cycle: you have to wash your hands 50 times or else you will make your loved ones sick and kill them. So, you get the anxiety, you accept the thought in your mind, and you do not wash your hands 50 times. You wash your hands once and then walk away. Yes, that's very difficult, but you're breaking the compulsion and you're just being logical because the CDC says 20 seconds with soap and water. That's it. There's no point in doing the other 49 hand washing times, but that's just your OCD saying that you have to and you don't. The golden treatment for OCD is ERP, which is called exposure response therapy. Only an OCD specialist is trained in ERP therapy, so make sure you find someone specifically licensed in this type of therapy. This is a lifelong process. There's no cure for OCD. ERP entails a gradual buildup of exposing people to scary or stressful situations that trigger their obsessions or fears over time. It is not flooding. With a trained professional, you will create an exposure hierarchy and start with your less stressful OCD obsessions, then move up to the scariest ones. Now, skin picking disorder, it's another form of OCD where someone picks or bites their hair, skin, and or nails. Skin picking disorder is currently classified as an impulsive control disorder. So, skin picking disorder is also sometimes referred to as body focused repetitive behavior. And it is also referred to as an obsessive compulsive spectrum disorder or OC spectrum disorder because it shares features of OCD. Research suggests that most effective treatment for skin picking is cognitive behavioral therapy, CBT. I bet you've heard that before, including the specific types of CBT called habit reversal training, which is HRT, and the comprehensive behavioral model, COMB. Acceptance and Commitment Therapy Act may also be helpful in treating skin picking disorder. Research also suggests that skin picking may be effectively treated with medications such as SSRIs. Now, navigating OCD and how to manage it. This is 11 best things for OCD, and actually you'll see a lot of these for everything else because there's a lot of overlap. First and foremost, ERP therapy with a licensed professional, medication if needed, mindfulness, meditation daily, get into a hobby or two, exercise daily, cut back on sugar, caffeine, and carbs, get into a daily and nightly routine, get up at the same time and go to bed at the same time unless you're sick or on vacation, spend at least 20 minutes outdoors, if not more, limit screen time. And most importantly, you need to resist those compulsions and then completely cut out compulsions. Now, when I am having a really, really stressful time, I have more OCD symptoms pop up. And 9 times out of 10, I'm not going to do compulsions. There are times when it's really sneaky, sneaky little bugger, and I don't realize that I'm doing a compulsion. That's perfectly normal. If you catch yourself doing a compulsion, stop immediately and go do something else, anything else. Because it's better to do a compulsion for 3 seconds and then you catch yourself and you go, oh, wait, nope, we're not going to do that, versus you just go full out with your compulsions and you do it, quote unquote normal time of like, okay, you're going to wash your hands for an hour straight and now your skin's bleeding. That is not preferred. What is preferred, and what I do all the time when I'm in those stressful situations and I haven't figured out beforehand what's going to happen, but I catch myself in the compulsion, I stop immediately and I go do something fun or productive. Now, some other great resources for OCD. Nathan Peterson's YouTube channel, OCD and Anxiety, fantastic. No OCD, which is an online ERP therapy app and website with licensed professionals. This is a great resource. Therapy in a Nutshell speaks about OCD often. Dr. Martin Seif's books are amazing. Lee Baer's books are amazing, and OCD International online for those people with OCD that are outside of the United States. These are some of the best resources and the most legitimate resources. So these are also going to be in the description box. So don't stress out about writing these out. I'm also giving you some time and kind of like talking a little bit extra with long pauses, but these are in the description box. Okay, moving on to PTSD trauma. Post-traumatic stress disorder is a mental condition that's caused by an extremely stressful or terrifying event, either being part of it or witnessing it. Symptoms may include flashbacks, nightmares, severe anxiety, and uncontrollable thoughts about the event. And that's a quote from Mayo Clinic. So the signs and symptoms for PTSD, there are many symptoms and signs, but here are just a few. Easily scared or jumpy, severe emotional distress or physical reactions to something that reminds the person of the traumatic event, unable to be in big spaces, small spaces, or people in general, nightmares of the trauma, avoiding people, places, and or things that remind you of the trauma, reliving the traumatic events known as flashbacks, intrusive thoughts, feelings, images, and sounds from the traumatic events, always being on guard or feeling like you're in danger, trouble sleeping and trouble paying attention, physical reactions like sweating, shaking, having a panic attack, or going into psychosis, and also self-destructive behavior like drinking or driving too fast. How to receive care for PTSD. First and foremost, you need to find a trauma/PTSD specialist. These therapists have been trained and are certified to treat PTSD. It's often called trauma therapy. Talk therapy has been known to help a little bit, but after a while, just doing talk therapy for trauma actually makes things worse. The most popular trauma therapies are eye movement desensitization and reprocessing, EMDR, cognitive behavioral therapy, CPT, trauma focused cognitive behavior therapy, TFCPT, and prolonged exposure therapy. Other types of therapy that are helpful are emotionally focused therapy and solution focused therapy. Oftentimes, you need to do multiple types of therapy to become subclinical, but this is absolutely normal. You will also need to continually be in therapy, even if you're seeing your therapist a few times a year, and even if it turns into just talk therapy, because there is no cure for PTSD, and you're going to have some ups and downs. That is life. And even positive big changes can trigger PTSD. Navigating trauma and PTSD, a lot of these are similar, but medication if needed, please seek out a trauma specialist for therapy. And it's very important that it's a trauma specialist, or also known as PTSD specialist, but it's usually see trauma specialists. Mindfulness and meditation daily, and Also, a good thing is yoga because that is physical mindfulness practice, and you need to bring your mind and body back together. You need to get into a hobby or two or three. Daily exercise, at least 20 minutes a day, if not more. Cut back on sugar, caffeine, and carbs. Get into a daily and nightly routine. Get up at the same time and go to bed at the same time unless you're sick or on vacation. Spend time outdoors, limit screen time. And the best place to go, I think, for talks about trauma therapy is Tim Fletcher's YouTube channel. Oh, it's gone blurry again. Oh, no, it's back. Thank you. What is generalized anxiety disorder, aka GAD? Well, GAD is excessive ongoing anxiety and worry that are difficult to control and interfere with day-to-day activities. From the Mayo Clinic, GAD has symptoms that are similar to panic disorder, obsessive compulsive disorder, and other types of anxiety, but they're all different conditions. So, symptoms and signs: persistent worrying or anxiety about a number of areas that are out of proportion to the impact of the events, overthinking plans and solutions to all possible worst case scenarios, perceiving situations and events as threatening even when they aren't, difficulty handling certainty, indecisiveness and fear of making the wrong decision, inability to set aside or let go of a worry, inability to relax, feel restless, and feeling keyed up or on edge, difficulty concentrating or the feeling that your mind goes blank, fatigue, trouble sleeping, muscle tension or muscle aches, trembling, feeling twitchy, nervousness or being easily startled, sweating, irritability, nausea, diarrhea, or irritable down bowel syndrome. Oh my speech impediments are going a little bit. Let's take a break. And like I have all of these, so it's I'm like, oh look, it's me. How to treat GAD? Well, GAD is usually treated with a combination of psychotherapy and medication. It cannot be cured, just like basically all of these uh, mental disorders that I'm talking about. But I want to remind people it can't be cured. And if you see anyone saying that they can cure it, they're full of BS. Uh, Number two, find a psychotherapist that specializes in generalized anxiety disorder. You might have panic disorder, which is different than GAD, or you might have both. They can be misdiagnosed if you see a therapist and they don't know the differences. So that's why it is important to look for someone that specializes in generalized anxiety disorder. Cognitive behavioral therapy is a well-established and effective psychotherapy for GAD because it focuses on identifying and changing negative thought patterns over time. Navigating generalized anxiety disorder and how to manage it. Medication if needed. Seek out a specialist in GAD to work on CBT, and you might also get some other types of therapy. Just really depends on the person and what other mental disorders you have. Mindfulness and meditation diet daily. Get into a hobby or 50. No. No, not 50, that's too much. Exercise daily, cut back on sugar, caffeine, and carbs. Get into a daily, nightly routine. You need to get up at the same time and go to bed at the same time. And spend time outdoors at least 20 minutes a day. And also, I mean, for everything, if you're in a climate that is colder or drearier, or it's wintertime, please think about vitamin D, getting that vitamin D. Very important. Uh, Definitely limit screen time. Please limit screen time. There's so much anxiety popping up because we're on our phones constantly. And then lastly, check out Therapy in a Nutshell's YouTube channel for extra advice. She's fantastic and like all the things, but she does have a lot about generalized anxiety disorder. Now, what is depression? This is from the National Institute of Mental Health. Everyone feels sad or low sometimes, but these feelings usually pass with time. Depression, also called major depressive disorder or clinical depression, is different. It can cause severe symptoms that affect how you feel, think, and handle daily activities, such as sleeping, eating, or working. It is an illness that can affect anyone, regardless of age, race, income, culture, or education. Research suggests that genetic, biological, environmental, and psychological factors play a role in depression. Yeah, it's not just one thing anymore. It's so many things. And from the Mayo Clinic, these are signs and symptoms of depression. Feelings of sadness, tearfulness, emptiness or hopelessness, angry outbursts, irritability or frustration, even over small matters, loss of interest or pleasure in most or all normal activities such as sex, hobbies, or sports, sleep disturbances, including insomnia or sleeping too much, tiredness, and lack of energy, so even small tasks take extra effort, reduced appetite and weight loss, or increased cravings for food and weight gain. It just depends on the person. Anxiety, agitation, or restlessness, slowed thinking, speaking, or body movements, feelings of worthlessness or guilt, fixating on past failures or self blame, trouble thinking, concentrating, making decisions, and remembering things, frequent or recurrent thoughts of death, suicidal thoughts, suicide attempts, or suicide, unexplained physical problems such as back pain or headaches, or even stomach aches and muscle aches as well. Causes of depression. So it is not just a chemical imbalance in the brain as it was previously suggested. It is many factors. So also keep in mind and have your feelers out. If anyone says that's professional, that says it's just a chemical imbalance in the brain, that person is not up to date, and you need to find someone else that is up to date because the whole chemical imbalance in the brain has been debunked. So first up is biological differences. People with depression appear to have physical changes in their brains. The significance of these changes is still uncertain, but may eventually help pinpoint causes. Brain chemistry. Neurotransmitters are naturally occurring brain chemicals that play a role in depression. Recent research indicates that changes in the function and effect of these neurotransmitters and how they interact with neurocircuits involved in maintaining mood stability may play a significant role in depression and its treatment. Hormones. Changes in the body's balance of hormones may be involved in causing or triggering depression. Hormone changes can result with pregnancy and during the weeks or months after delivery, which would be postpartum depression, and from thyroid problems, menopause, or a number of other conditions. Inherited traits. Depression is more common in people whose blood relatives also have this condition. Researchers are trying to find genes that may be involved in causing depression. So, yeah, there is just so much extra work that needs to be involved with depression because it is hard to pinpoint. It definitely is hard to pinpoint and work on, but that does not mean that you are a hopeless case. I've had depression since I was really born because it's in my family, and then I also have um, hormonal issues, and I have trauma. So all of that is just stacked, but that doesn't mean that you're a lost cause. Now, how to receive care for depression. Depending on the person, there are many types of therapy for depression. The following are the most popular: CBT, ITP, group psychotherapy, ACT, and a new one, dialectical behavioral therapy, DPT. Medication is often just prescribed for treatment of depression, but it is not the end all be all treatment like it was in the past. Medication and therapy are used together in the treatment of depression. Some people will have depression all their lives, and others it dissipates over time. This wholly depends on the person and what their other mental disorders are, if they have trauma, if they don't have trauma. It just really depends because there are times where women will have postpartum depression and then that goes away and they never have it again. Whereas, there's people like me that it's just one, runs in the family, and then 2, I have a bunch of other mental disorders, and that does not help. And I have hormone issues, and I have trauma. So it just sometimes it's a lot of things, and sometimes it's, oh, you just gave birth, and so you have postpartum depression. But like with treatment, that does go away. Now it could pop up again if you have another child, or maybe like your first child you had postpartum, then you have a second child that didn't pop up, but then you have a third child and then it came back. So with that one, it's like, I wouldn't say cured, but it's a difficult thing. It's confusing as well. I totally understand. Navigating depression and how to manage it. Basically, the same as many of the others. It's just the same as the others. What I say? There's overlap. Yes, there is. Yes, there is. But yeah, these really work. Well, the main thing as well that would be number 2 that's different is to seek out a specialist in depression. Yes, very important. And get that vitamin D. What is ADHD? Attention deficit hyperactivity disorder is a mental health disorder that includes a combination of persistent problems like difficulty paying attention, hyperactivity, and impulsive behavior. Children and adults can have ADHD, though not every child is diagnosed, even if they show signs at an early age. So, signs and symptoms of ADHD. Some people will have a decrease of symptoms as they age, but many will have ADHD as adults that affect their lives, some of which would be impulsiveness, disorganization, and problems prioritizing, poor management skills, problems focusing on a task, trouble multitasking, excessive activity or restlessness, poor planning, low frustration tolerance, frequent mood swings, problems following through and completing tasks, temper issues, trouble coping with stress, even minor stressors. Taking a break here. ADHD information continue because we've got a lot. Everyone shows signs of some symptoms that are like ADHD as children, but that does not mean everyone has ADHD. ADHD is diagnosed when there's a disrupt in one's life and the symptoms are reoccurring and affecting one's life that it is hard to function. These persistent symptoms can be traced by your childhood up to adulthood. ADHD can sometimes be difficult to diagnose because the symptoms are similar to other mental illnesses and disorders such as depression or generalized anxiety disorder. Always seek professional advice. You can speak to a psychiatrist, your doctor, or a therapist for diagnosis, especially look for a ADHD specialist. The cause of ADHD is still unknown, though it does have connection to one's genetics. So the treatment for ADHD, this is a lifelong brain disorder that reacts well to medication. So it's a neurological disorder. CBT and ACT therapy are often used for ADHD treatment. One's therapist will also work on organizational skills, social skills, teaching impulse control, and getting on a daily routine. And that's all part of managing ADHD. It cannot be cured, but well managed. You do not need to be on a medication, but it can be beneficial depending on how badly it is affecting your everyday life. And it, of course, always comes down to it depends on the person. Navigating ADHD, this is very similar to the other ones, but we've had some additions, namely the last 2, 12 and 13. You're going to have to work on impulse control with a professional, and also they might help you with organizational skills and a couple other things like anger issues. Like if you have anger issues, you can learn about controlling your anger and your frustrations. And then also 13, this is a big one. Set reminders on your phone, computer, use sticky notes, etc., so you don't forget important things. And you can also think about time in seconds instead of minutes. That helps a lot of people. It doesn't really help me. Probably because of my math disability. I was like 300 seconds. I don't know. But if you say, for example, 5 minutes, some people don't understand 5 minutes, but they will understand 300 seconds, that type of thing. Yeah, there's some funny stuff that you can figure out with ADHD and it works. But that's why you should look for a specialist in ADHD, because if you just go to talk therapy, they're not going to know much. And oh my gosh, we're done with the presentation. Thank you so much for joining me today. If you have any questions, please let me know down below if you're comfortable. And all the information, the citations and resources, once again, are in the description box below. Thank you so much for joining me today, and I hope you have a fantastic day, week, month, year, life. And just remember that, yes, this work is very hard. You have to be patient with yourself, compassionate with yourself, even though you might feel like you want to scream into a pillow. Maybe do so. But with work and time and professional help and slowly building up your self-esteem and your knowledge on the mental disorders that you have, you will eventually get better. Life is full of ups and downs. Healing is not linear and everything is temporary. So please keep that in mind. You're not failing, even though you feel like you are. It's just really hard. I'm not going to lie. All this is hard, but I hope this helped in any way. Thank you so much for watching, and ta-ta for now.